Hey friends, welcome back to the You Are Not Broken podcast. We're going to dismantle myths, amplify voices, and empower women to own their health, bodies, and pleasure. Today's guest is Dr. Sara Reardon, aka the Vagina Whisperer, board-certified pelvic floor physical therapist, TEDx speaker, mom, and author of the newly released Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage. Welcome.
Thanks for having me, Kelly.
Your book is beautiful, not just the
Thank you.
cover, but really, it's really comprehensive and it's got something in there for everybody.
Yeah. And that's what I wanted. I thought about when I was writing the book or the idea for it came about, it was like I could write a book about menopause and pelvic floor health. I could write a book about, pregnancy and birth, but I felt like there wasn't even the 101 guide on the pelvic floor. And that's why it is so comprehensive. I was like, we just need a starting point for women to better understand this part of their body. So I hope that that's what it is doing for women.
I love that. Watch out. This is how you end up writing more books.
Okay.
It's like, and then there's a menopause one, and then there's a postpartum one, and then I didn't say enough about this, so there's that one. And you're like, that's how you have a series.
Yeah. I'm in my fourth trimester of book writing right now. So I'm like coming down of like, okay, it's all over. The launch is done. And so I'm just ready for a nap.
Yeah.
And then
there's like clothes all over the floor and your hormones are like shit. And
you're like the bags under my eyes.
Yeah, nobody touched me.
How did you know? Right. Exactly.
You're like, and then and then a year goes by and you're like, wasn't that blissful?
I know.
Wasn't that great? Didn't we help people?
I know. Well, that's the beauty of it is that I think that, I just finished my last floor tour event yesterday and there were 7 stops and to meet so many people who the readers, the followers, and for just them to continuously say like, this was so amazing. Thank you for doing this. And as someone who's, love language is words of affirmation, I'm like, oh my goodness, this is so wonderful. So I'm thrilled it's out in the world. I feel like I sent a kid off to college and like do good in the world and just, it's nice to have 2 years of work kind of really just be out there living and in people's hands and homes.
Yeah. I mean, I think like my books are like, they're kind of like my baby. And like, for me is like, don't tell me my baby's ugly.
I'm like, oh, my baby's not ugly. My baby's beautiful. But, it's like
better mindset than me. I'm like, I love my baby. I hope you think that my baby is cute. Yeah. I spent a lot of time making my baby.
Yeah. And your babies are cute, but they're also helping a lot of people. And these are, I think, the voices that are needed for women and in medicine right now.
Yeah, absolutely. The pelvic floor has, besides like the reproductive or the reconstructive urologists and urogyns, like we know about the pelvic floor, but like there's no other boss of the pelvic floor within the like MD Western medicine world. It really is the domain of physical therapists. And I think just because I've practiced hand in hand with physical therapists for so long, I often forget that people do not know what you guys do.
Yeah.
And they don't know that anybody's the boss of the pelvic floor.
I think the majority of people don't know what we do. I mean, I think a lot of medical providers in general, I mean, you're a skilled progressive clinician and really kind of up to date with what the best way to kind of help people with urological and pelvic floor dysfunction is. But, I work with gynecologists and, GI doctors and colorectal and they're like, what is the pelvic floor? And like, is therapy just Kegels or biofeedback? And it's so much more nuanced. And I'm like, gosh, I can't believe, 18 years after being in this field, we're still having the same conversation, which I think is why it's so necessary for more research and more books and more exposure to pelvic floor health and pelvic floor therapy to keep going because people still don't know.
Yeah. Totally. I mean, Kegels, we'll jump in quick. Kegels is a pelvic floor contraction named after Dr. Kegel, who I think was a gynecologist.
Yep.
Tends to help weak pelvic floors. It's not good at all if you have pain.
Yeah.
Right?
Or tension.
Yeah. So it's actually, Kegels can do harm.
Yeah.
So when people are like, oh, just do Kegels, you're like, oh God, no, it's only if it's the right tool.
Right. And I think that that's one of the things, I compare it to other forms of therapy. So as a physical therapist, we work with muscles and tissues and nerves, and I work with the muscles and tissues and nerves in the pelvic floor region, which, just to kind of give everyone a 101, it's, these muscles are responsible for supporting your pelvic organs, your uterus, your bladder, your balls, and males, the prostate. It has the openings for the urethra for urine to exit, the anal opening, the vaginal opening in female bodies. And, it works when you're breathing, when you're moving, when you're lifting, when you're menstruating, when you're sexually active. So these muscles are so integral to day to day function and every stage of a woman's life. And the fact that most women don't even know that they have one and the majority feel, grossly uneducated about how to care for this part of their body, I think shows just such a huge gap in women's health education and women's health in general because people are suffering and they don't even know that their muscles could be the problem, and then they maybe stumble across a post or an outdated blog or a medical provider that says like do your Kegels, and they're like, one, most women don't even do
They don't know
Kegels
how to do it.
properly,
Yeah.
and two, it could be the wrong thing, and so they're making their issue worse. So I think, again, just with Floored coming out, I really hope that this is a resource that someone at every age of life can pick up and learn something about their body and then teach the next generation to come.
Yeah, and I think to realize it matters. I mean, the average woman waits 8 years after bladder leakage to see a specialist. At least that's in the urology literature. And then so many women, they come and then they're like, "But isn't this normal?"
I know.
And I'm like, "Common doesn't mean normal."
Correct.
Right? And
Correct.
they wanna be validated, but at the same time, it's like, dude, urologists who care, like, they're never gonna blow off somebody who is having trouble urinating, right?
Yeah.
But we have not enough urologists who care, and
Well, and they're not
e
getting referred to you soon enough,
yeah,
I think it's one of the things that. And it's, the research is very clear that if we're not asking patients about these issues, they're not going to tell us because they're embarrassing, they're intimate, they don't even know who to go to for help. And so by the time they get you, these issues are now chronic. And then, about physical therapy and the things that can help in conjunction with medication and procedures. But I think most people, again, a lot of physicians don't. And so then it just becomes kind of a longer time to get help. And I think one of the things I really love about the way that you practice and a lot of kind of people in my sphere as well is that it's a puzzle pieces that we put together for patients. It's not just medication. It's not just therapy. It's not just a procedure. It's like, what do we have to put together to give this patient the best outcomes? And it's usually a combination of all of those things.
Mhm.
And that's why I think it's so important for and physicians to work so closely because it's like, that's how we're going to best help the patients.
Yeah, I love that. I mean, for especially for pain with sex, bladder leakage, bladder
Yeah.
problems, it's like we need vaginal estrogen and pelvic floor PT,
Yeah.
and the PTs know that. They're like, "Where's the vaginal estrogen?" And the people
Yes.
who know about the vaginal estrogen know that the PTs are important, and I tell women because a lot of people are like, "I just gonna wanna try one thing." And it's like, you want to see success, and you will see more success when you do all of the things.
I know.
I talk about a three-legged stool, especially for pain with sex. Of like,
Hmm.
my three-legged stool is sex therapist, physical therapist, and then hormones. And it's like, if you don't do one of those legs, the stool falls over.
Yeah, you're totally right. And it's interesting because I think that what happening with like pelvic care and pelvic health now is that it's almost getting into this wellness sphere. Like when something starts to getting buzzy, it's like sit on this vibrating chair, insert this magic wand in your vagina, or like just, take these gummies or whatever the case may be. And this is true health care. I mean, these are true issues that people are experiencing, but yet I think everybody wants kind of that quick fix. But to your point, like if you've had leakage for 7 years, like it takes time to rebuild that muscle strength, to retrain your bladder, to change how you're peeing or pooping or breathing or moving. And it can feel overwhelming, but yet it's actually really simple. And that's really what I cover in the book are like, what are the day-to-day things you can be doing that you probably have just never been taught? Like literally not pushing when you pee and sitting down to pee instead of hovering, like just the basic things that nobody ever told us that could be affecting your bladder health.
And how many times a day is normal to pee?
I know most people
Right?
don't
Like,
know.
how many people with recurrent urinary tract infections? I'm like, "How many times a day do you pee?" And they're like, "2." I'm like, "Dude, you gotta get it out. Gotta get it out."
I'm like, I want to be your patient. I want my doctor to tell me, like, girlfriend, let it go.
Yeah. I'm always like, "Dilution's the solution to pollution."
I
And
love
they're like,
it.
"What?" But I'm like, I'm nice, and I'm like, "Hey, listen, nobody in 2nd grade, nobody's like, 'And this is what's normal for how many times you should pee a day.'"
I know. Well, what's interesting is that one of the most common questions I've gotten after writing the book and since being on book tour is how do I talk to my kids? How do I teach these things to my kids about their pelvic floor so that they grow up kind of knowing their normals? And, I don't have the roadmap for that, but I think a lot of it is like if you know better, then you can teach them better. Like if you know that you're supposed to pee every 2 to 4 hours and you shouldn't go just in case, and, certain things may irritate your bladder, then it's like you can kind of that just becomes part of your lifestyle. But if we don't know, we can't teach them. And then I think that the other thing is we have to talk about these problems. I always say we want to normalize the conversations, not normalize the problems. And if we are open about what's happening with our bodies and we can talk about them, then our kids know that like the door is cracked. And if you have questions, you can come in and ask them versus feeling like I don't know who to talk to about them. So I really hope that that's the ripple effect it has too, is just kind of bringing up another generation that has more body awareness and health education and pelvic floor awareness than, yeah, I would say I did, or, especially my mom's generation.
Yeah, I love that people are asking that question. That's fantastic. I would
It's
say,
one of
like,
the most common ones I get.
"Oh, that's so cool." I mean, to me, I'm like, talk about it because just talking about it, sunshine is the best disinfectant of like the amount of shame. I mean, for the love of God, it's called the pudendal nerve, which
I
basically means like
know.
the shameful place, right?
I know.
Like all the wording doesn't help. Not that people know what like the Latin origin of vagina is, but it means to sheath, right?
Uh-huh.
Like
Sheath
to
for sword.
to
I
sheath
know.
the sword, right? Like there is a tons just the way we've named this part of the body is shameful. But just that your kids know what that it's a vulva and that
Yeah.
the external skin is not the vagina, right? That you pee through your urethra.
Yes.
Right, it's just, like, use the terms so that when the time comes, they can articulate where the problem is. Like, if you go to a doctor and you say it hurts down there, and
Yeah.
the doctor doesn't do an exam, you're basically just gonna get an antibiotic,
Yeah.
right? And then you believe I'm having infections because they keep giving me antibiotics, blah, blah, blah. And it's like, if you can't communicate and we don't examine, you're in a black box.
Yeah. I know. Do you feel like physicians are still practicing that way?
Well, yeah. But I mean,
Yeah.
and the other thing, and this is not the physician's fault, this is technology of like, we know that when you do telemed for a recurrent UTI, antibiotics are used more inappropriately than when you are in person. So it's like technology is even taking away the ability to examine, which is good. It's improving access.
Yeah.
But, and even if you do get an exam, the amount of people who I say can examine properly
Yeah.
is lower than the amount of people who can examine. I see so many people with genital urinary syndrome of menopause, and they're like, "Oh, if I had 3 gynecologists tell me it looks normal down here." And I'm like, first of all, you have symptoms. That's not normal. And second of all, oh my god, you have clitoral phimosis and no labia, and it's
I
raw, and
know.
of course it burns when you pee, and antibiotics aren't the solution to this.
I know it's interesting, and I think that, yeah, I mean, I'm in the South, so I feel like we're always, a little bit behind the rest of the country when it comes to healthcare, particularly for women. But I think one of the things that I've really seen kind of transform over the years as a pelvic floor therapist, I've been practicing in this field for almost 18 years, is now we're seeing women for the first time. They're coming in with direct access without referrals, and we're kind of looking at their vulva going, okay, this looks like, GUSM, like you've got thinning tissues, they're raw. And it's like they're having like little micro tears and bleeding when I'm doing an internal assessment. I'm like, you have to go see a urologist. And so, but they're coming in for pain with sex. And we're the ones saying, like, hey, this is going on. And they're like,
Yes.
oh, well, I only need a pap smear every 3 years now. So I don't go see my gynecologist anymore. And so you're kind of starting to see that there's different points of entry. And I think that it's been helpful for me to be able, like, I'm looking at vulvas all day and I'm like, okay, this is a de-estrogenized vulva. Like, you gotta
Yeah.
get back to the doctor,
Yeah.
This is not a muscle spasm situation.
Yeah, and I mean, this is my world now, but I always like to tell my story because it wasn't always my world. Like, the first time I went to an Ishwish conference, and they're like, "Yeah, your labia goes away when you don't have hormones," and I'm like, "I just thought all these 70-year-olds were born without labia minora." Right? Like, because I didn't get taught that.
Didn't get labia,
Yeah, the boomers did there was something in the water, and the boomers didn't get labia. So, I'm like,
It's
if that's what
hysterical.
I had to have the aha as I became more passionate about female sexual health. That's like, look, that is not being explained to people. And I would say that's
Yeah,
like the disappearance of the labia.
yeah,
Curious if you see this on your social media, but women are horrified by that.
yeah,
And the
I
doctors are
know.
kinda like, the doctor's like, "Well, it doesn't, like, shorten your life or anything, so, like, that's not the worst thing that can happen." And women are like, "Oh my god, why is nobody telling us this?" And I'm like, "'Cause
Yeah,
if I go around screaming, 'Your labia is gonna disappear!'" Like, it's a little scare tactic-y.
yeah, but if it does help women get on topical estrogen proactively, then I'm like, well, that's maybe the scare tactic we need, because if that's like, what is
I
it
know.
that's gonna do that? That's gonna make them go in and be like, I think I need this, you
Yeah, I would
know?
like my labia to not disappear, thank you very much.
Yeah.
Because the next natural question is, do you get it back by being on hormones?
Mhm.
And enough hormones, yes, but we don't have studies on it. We don't know if
Yeah.
everybody can get it back. We don't know the
Yeah.
optimal levels of hormones that are needed once it's gone, right? Like, we don't have any research on that.
Well, it's interesting because, I did, yes, I see that on social media, and I think it was, Dr. Rubin who did a video on it, and everybody kind of started being like, "Wait, what?" And it's
Yeah,
true. I think people don't know what is going on with this part of their body. They don't talk about it, they don't think about it, and they don't look at it. And so one of my biggest things is like, I talk about this in the book, where people are like, "How do I know what's going on with my pelvic floor? Or how to evaluate?" I'm like, "You have to look at it first." So and it's a big ask because even in the clinic, when I ask my patients, like, "Hey, do you want to see what I'm seeing? Like how your muscles are contracting and how you're bulging and how your tissues look?" And many of them are like, "No, I don't." And because it's very intimate and it's overwhelming if you've never connected with it. And so, but I also say like more medical providers and partners have seen this part of your body than you have. Like
right,
that's happened more often. So it is important that especially as we go. I mean, I'm 42 and perimenopausal. Like you have to kind of know what your parts look like so you know if they're changing. Like then you'll know, like, whoa, was I born without labia or are they just disappearing now, you know?
right. Yeah,
So
yeah, totally. I see it would not infrequently, a woman will come in and she'll be like, "What's this hard thing?" And she's, like, pushing onto something, and I'm like, "That's your urethra."
yeah.
And, like, they'd never looked before, right? And they never
Yeah.
had anybody, like, explain, like, "This is your urethra, this is your blah, blah, blah," and they'll feel it or they'll, like, put their finger right in it and they'll feel their pubic bone. Like,
Oh
"What is
yeah.
this?" And I'm like,
Like
"That's
bone.
normal anatomy. Congratulations. Now you know what it looks like. Let's move on." But, yeah, it's a lot of, like, normal anatomy checks, right? Which can be very
Totally.
reassuring to people.
Yeah, totally.
Let's talk about your TEDx and postpartum care.
Okay.
And I think we both hate the same thing, which is at 6 weeks, which is at 6 weeks, we're like, "Good to go."
Yeah. I started the Vagina Whisperer Instagram account in 2017 when I was pregnant with my second son. And for two reasons. One, I was pregnant with my second son and I was doing a lot of birth prep things. And, I was answering the same question for my group of girlfriends who were also all having babies around the same time. And I said, let me just put this on social media so you have it as a place to go back to. And because it was cheap and free, it wasn't like I had this, master plan as to what was going to happen. The other thing is that I had so many moms coming in postpartum, 3 months, 6 months, a year, and they were like, "I feel like my body is broken. I'm leaking. I'm having pain with sex. I can't pick up my kids because I'm having sacroiliac joint pain." Why didn't anybody tell me that therapy was an option for me? Like, why didn't they tell me to come sooner? And so both of those things were like, why aren't we helping women sooner? Like, going through pregnancy and giving birth is such a huge physical transformation and then you're just sent home. And it's literally like if you'll go through surgeries or anything else and you get physical therapy and care afterwards. And after giving birth, you get absolutely zero. And 40% of people don't even attend their postpartum gynecological visit.
Whoa.
40%.
I didn't know it was that high.
Yeah. I mean, think
Wow.
about it. Lack of access. You're back to work. There's no paid maternity leave, no childcare coverage. There's a lot of barriers to access. And a lot of people don't find that visit particularly helpful either.
Right. Fair
So,
enough.
so I think there's multiple reasons. I hope that that's changing because I do think it's a medically necessary check-in. But again, when you go back to exercising, if you do exercise at 6 weeks postpartum, your pelvic floor muscles are functioning at 50% of their strength. But yet you're told to go back to everything you were doing pre-pregnancy, weightlifting, running, sex, and your body is functioning at less than 50% and you're probably sleep deprived and you probably have low estrogen because you might be
Yes.
lactating or breastfeeding. So it's this kind of perfect storm of creating the opportunity for pelvic floor issues for women that again could potentially be prevented or at least managed sooner. That's really what that TEDx was about was like we need to better help women and I was in that postpartum phase and I mean I think that women are walking around caring for babies and we are in survival mode but we don't see what's going on behind the bathroom doors, behind their bedroom doors, in their underwear because it's hidden. And I think that I just wanted to bring light to everyone who's experiencing these things and they feel very alone and they also feel like there's no options and there are definitely options.
Yeah. Yeah, I think and when you dig into it and you're like, "Wait, you're telling me there's no data or science on the you're good to go with sex at 6 weeks?"
Yeah.
Like, it's heartbreaking at that point because 'cause you're like, "Well, that was made up."
Yeah.
Right? It's
It's
totally arbitrary.
It's totally arbitrary, and yet it's the standard of how we're practicing medicine, and again, it's no fault of I mean, I think physicians are so overwhelmed and so just bogged down with their caseloads that it's hard to really do thorough examinations and really get into kind of helping women during that period, that kind of postpartum period as much as they want. Like you just don't have the capacity. And so that's where I think pelvic floor therapy can play a really integral role in recovery and rehab, regardless of what method you birth, vaginal or cesarean birth. I think it's needs to be a very necessary and standard part of postpartum care.
Yeah. And I think just normalizing for women, like 6 weeks is incredibly early to
Yeah.
expect normal and healthy sexual function, running function. Like running it is what was it? It's like 3 Gs of pressure on the pelvis. Like
Yeah.
running is a crazy amount
Amount
on
of
the pelvis.
yeah.
And if your pelvis is not recovered, like
It's not
don't
recovered.
right. And it's not by definition not recovered of like
Yeah.
and our society is so, like, go, go, go,
I
and
know.
Hollywood effing perpetuates the, like, "Look at her, she just had a baby, now she's on the red carpet, blah, blah, blah." It's
I
like,
know.
"Fuck you."
It
But,
is,
like,
and now with
the
social
pressure.
and even with social media, I mean, I think we're looking at moms and it's like, it's so easy to feel like, gosh, they're out and about and they're working out and they look like they have it all together. And I'm like, listen, I have worked with so many women over the years and nobody has it all together. Like we are all just hot mess express behind the scenes. So like don't feel like you are doing less than. And I tell my moms who come in to see me all the time, the ones who wait 12 weeks to really go back to higher intensity exercise and use those first 6 weeks just to get moving, to walking and rebuild just a little bit, a basic, core and pelvic floor strengthening to build that back up, do better in the long run than the moms who are back to running at 4 weeks. Because your body is not ready. And I think then you're swimming upstream trying to catch up to a pelvic floor problem where if you just kind of wait and build slowly, you're going to do so much better in the long run.
Yeah, and I think, like, there was just very recently, like, a long distance endurance runner who, like, won and was breastfeeding, and, like, it's like, dude, that woman has trained for years and years
Yeah.
and years and years to do that to her body. Right? And to think that that's what everybody should do or that's the ideal thing to do is like, no.
Yeah.
Like,
I mean, she's amazing. And we see this a lot with like heavy weightlifters who they're like powerlifting and hitting PRs and but they're peeing on themselves in the videos. And it's kind of the same thing. Like these women are going for a competitive max. This is their professions, their jobs, their passions, whatever the case may be. But we don't know how their pelvic floors are functioning. And I know that the one lifting weights peeing is like her pelvic floor's not. It's kaput, but she's making a choice to do that at the sake of her pelvic floor muscle function. So I'm always like, at least if you know what you're doing, you make the choice. Like there's always options. But yeah, we don't. The majority of us don't need to be running marathons.
no.
In
Yeah,
the
I mean,
first
some
year.
of the most devastated women that came to see me are early postpartum. They maybe feel a little bit of a bulge or the sensation of I feel a bulge, so their
Yeah.
pelvis feels unsupported, but they don't have on exam a grade 3 cystocele, right?
Yeah.
Like nothing's
Yeah.
actually falling out of the vagina on exam, but they have this incredible feeling of
Yep.
lack of support. Like I'm walking up the stairs and I feel like my pelvis is going to fall out of my vagina. But on exam, they don't have what we call surgical cystocele,
Hmm.
right? Like nothing's actually falling out. And to me, it's very, I try to validate them of like, yes, your pelvis feels unsupported because you are not healed, but they want a surgical fix now. They want it better now. And they cry in my office because they want it now because it feels so bad. And it's like, girlfriend, you have to heal. You have to
Yeah.
heal. You have to go through rehab.
Yes.
You just created a life, but they are psychologically wrecked over it because nobody told them that
Yeah.
this is what happens when you have babies. Right? It's like we have this perception that like babies happen without any insult to the female body.
Yeah.
Right? And it's like,
Or hope, But, I think that some of this has to do with pregnancy is like we're supposed to be training for birth. That's how I view pregnancy. And we're not giving moms those tools. We're
mhm,
kind of saying, do what you always do and listen to your body. I'm like, during pregnancy, your body's speaking a different language, like you don't really understand what's going on anymore. And you may feel a certain way, but your body is transforming and changing. I think that during pregnancy is a real opportunity to start giving women the tools because it's very clear in the research that if you do pelvic floor training and exercises during pregnancy, you have better postpartum outcomes. And so it's just such an opportunity to help. It's like running the marathon. Like you just don't go run the marathon. You train for that. And that's how I view birth as well. Like we should really help women prepare for that and like let them know, hey, these are things that could happen. This is how you need to modify if this happens, if you're leaking, if you feel bulging, if you feel pressure, like that's your body telling you that, like, hey, you need to pull back, change intensity, slow down, like whatever the case may be. But we have this tendency to kind of just push through, but we don't know any different. We've never been told differently. And so I think that it's just so much education. And I see it changing, Kelly. I really do. I see people wanting to be proactive in their pelvic floor care during pregnancy and postpartum. It's just, I don't think that we have enough pelvic floor therapists to help everyone out there who needs it either.
Yeah. How many pelvic floor therapists are in America? Do you know?
I would say roughly like 3 to 4,000.
Ugh.
No, I'm sorry, not 3 to 4,000, under 10,000,
Yeah, under
under
10,000.
10,000. Yeah.
There's 80 million women over the age
Yeah.
of 40, and
Yeah.
that's over the age of 40, so not including the ones who are doing the brunt of the childbirthing.
Yeah. So
It's
about
pretty
10,000,
pretty bad.
it's not, yeah, it is. And I think that it's growing. I would say 10 years ago, it was maybe 3 to 4,000, and now it's like tripled. And pelvic floor therapy is one of the most searched terms on Google, pelvic floor therapy and pelvic floor
Ah,
exercise. So
interesting.
we see the awareness growing.
Mhm.
And I think it will be kind of a self-fulfilling cycle of like, then we have more therapists getting into the field. But we still need more access and more therapists out there, more resources.
Yeah, definitely. I see just in my practice, just in the last, like, 4 years,
Yeah.
insurance cutting back on, "Oh, you've met your physical therapy limit for the year," or copays, or, "We don't even cover physical therapy." Like, insurance coverage, in my opinion, from my practice, is getting worse and worse and worse. What are you
Yeah.
seeing nationwide as far as access from the payer standpoint?
So it's really interesting because the way that pelvic floor physical therapy is reimbursed is just like every other type of physical therapy, where you have 2 or 3 patients in the gym and you're seeing them all at the same time and you can bill for that. The way it works is like you bill, in 15-minute increments. And if you've got 3 people at the same time, you can bill for all of those. But in pelvic floor therapy, it's one-on-one. And so you still get reimbursed the same amount that, whatever it is, $20 every 15 minutes if you're seeing just one person. So, and then we know that insurance companies are just squeezing everything out where you have to have more, you have to see more people to make the same amount. And a lot of pelvic floor therapists are going out of network, kind of as you've done similarly, which is it's a cash-based practice. It's one-on-one care. I see that sometimes even going to a cash-based practice is less expensive than going to a clinic that takes insurance because one, it's transparent pricing. You know exactly what you're going to get. You get one-on-one care and it's an extended visit. I think that that's
Yeah, you could
supreme.
probably get more accomplished.
I have always I've practiced it this way for the past 8 years. But, I think when you are in a insurance-based clinic, they can be very effective. It's a different model that makes it harder. The sessions might be shorter. You might have a tech that's doing part of the care instead of just one-on-one. So it's just a different model to make it work. I think we need both. I don't think that everyone should be out of network, and I don't think everyone should be in network. I think we need to provide different options for people. It's, insurances are squeezing more and more out of people. In my dream world, pelvic floor therapy would be reimbursed differently than regular physical therapy because
Yeah.
it's a different type of care.
It's a different type of care. Yeah, that makes tons of sense. Do you see, let's talk about, like, bread and butter pregnancy, bread and butter
Yeah.
postpartum, or bread and butter. Are people getting help with YouTube videos? Are people getting help with online instructional videos? Like, because there are more resources,
Yeah.
right? Of, like, what are you seeing that, like, tends to work if people don't, in rural access, right?
Yeah.
Like, getting to see a physical therapist. Like, what is there that you would offer that if they can't get in to see some?
No, I think the great thing about medicine right now is you have options. So, and we really saw this transform in 2020, that it used to be all in-person care was like really the only option. And I don't think anything will replace in-person care. Like nothing is going to beat someone coming into my clinic and I can do an intrapelvic muscle examination and know exactly what's going on. However, if not everyone has access to a therapist, whether because it's cost or, location or, whatever resources you can do telehealth, which again, a lot of what we do is education. So it can be helpful. I think that, I have an online pelvic floor workout program for, strengthening and relaxation and birth preparation. And where I find that works best is actually in conjunction with in-person therapy, like a
Yeah.
bit of a hybrid model where
Yep.
you get even an evaluation. You say, okay, I know I have overactivity and tension. I'm going to go do Sarah's relaxation program and work on painful sex. Or I got, I'm ready to prepare for birth and I'm going to do these home exercises and programs, but I'm going to see a therapist to help for like learning how to push and whatever the case may be. So I really think it's an and model and not an or model. And then, even having a book out. I mean, I think not everyone is ready to go see someone in person and they just want a starting point, an entry point, a way to kind of just start understanding their body and to get a language and an understanding of what's going on in a more kind of private way. And so I think that we've got all of these resources now to help women in different ways.
I love that. I love the book as the intro point. I mean, so many women I see, number 1, they've got a history of trauma. Number 2, they don't know what the hell pelvic floor physical therapy is,
Yeah.
right? And so it's like the book is the great entry point because
Yeah.
then it's like this is what to expect. This is the pelvic floor, and even just kind of learning some of the lingo, then
Yeah.
it's less overwhelming for when you're like, I'm ready for the hands-on. Tell me where I'm tight, right?
Well, and
Like
it's like this is such a mystical part of our body, and we can't see it. And so I think that having these visual diagrams in the book and kind of just explaining the normals will just really help just give people like almost disarm them a little bit like, oh, this is like every other muscle in your body. Yes, it helps with peeing and pooping and sex and birth and menstruation, but it's a muscle. And if we just kind of learn how that muscle contracts and relaxes and when it's not working well, then we can treat it like we would any other muscle in the body.
I love the normalizing it of like because when you can't see it, you're kind of making it up in your brain. It's like, is it really there?
Yeah.
Right? Is it really just like a bicep?
I mean, and it is. For me, I mean, I think that that's hard because my normal is not everyone's normal. Like your normal is different than other people's normal. Like we have pelvic models all over my house. Like I just brought a cookie home for my kid who's 8 that says Viva la vulva. I mean, like my normal is very different. But I also think that these things can be normal. Like we can have, talks with our kids and have the language to teach them and the education and awareness to teach them and talk about these things. I mean, so yeah, it is. I do think we need to normalize some of these things. Just like I always say, going to the pelvic floor therapist could be as normal as going to the dentist. Like you get proactive tune-ups, you get check-ins, you get, they see something's going on and they treat it. Like that's how our pelvic floor should be. Like you get one of them and we need to help you take care of it across the lifespan.
I love it. Pain with sex. Where do you start?
I think one, you have to know the cause. I think your muscles can be a cause. I think de-estrogenation of the tissues can be a cause. You can have scar tissue from a previous tear. You can have dermatological conditions like lichen sclerosis or lichen planus. So there could be an infection that needs to be ruled out. So I always think like we have to know the cause. If there is like if you've got, tissues that are, de-estrogenized and you've got vaginal dryness, you've got, decreased lubrication. I do refer out for topical estrogen. I'm a huge fan of it. And, DHEA suppositories if people don't want to use topical estrogen. I also love recommending a vulva balm. My favorite one is by this company called Medicine Mama. It's like an oil-based balm and it just can really kind of soothe the tissues and moisturize them just on the days you're not using the estrogen. I love a good lube. Like I think everybody needs a good lube. And then if you are having pelvic floor muscle tension or scar tissue, I work a lot on like teaching them to release the scar tissue at the opening. We do intravaginal kind of you call it vagina massage, but it's like decreasing the tension of the pelvic floor muscles with some pressure point massage internally, using dilators and wands. A lot of what we do in the clinic is very hands-on, but I'm teaching you the tools on how to use these devices at home. If it's a vaginal dilator, to help your pelvic floor muscles relax. If it's a trigger point wand for internal pelvic floor relaxation. So I really want to help get you relief, but also give you the tools to help yourself at home so that if you have a stressful day and your muscle tension comes back, like you've got the tools to help yourself. And I think that that's really empowering for people.
Yeah, I love that. And I love the view of like just like your shoulder, like it'll get tight again, right?
Yeah.
And we're like, it didn't work because it's back. It's like that's not how bodies work.
Yeah.
Bodies have their own little memories of like when I get tension, the left shoulder goes this way, right? Of like, yeah, it can come back, but to have the tools to be like, let's nip it in the bud before it comes back with a vengeance, or that your awareness of like when I don't get my sleep, when I'm dehydrated, when I have stress in my life, that's
Yes.
when it gets worse, to be that insight of, like, the body can follow a pattern, and then we can be aware of that pattern to help it out.
I love that analogy, and I always say it's like your body has a path of least resistance, right? And if that path of least resistance is to be tight and tense, which I would say mine is in like my neck and shoulders, even when you calm the muscles down, it wants to go back to that state. And then you kind of help calm it back down again with the tools and resources from therapy and the things you can do at home, like breathing and stretching and all kind and changing your posture. And then it's going to want to get tight. We just want that the new normal to kind of be in this steady, relaxed state. And
Mhm.
then when it does get tense, you recover quicker, your symptoms are less severe, and they're kind of quicker to manage versus kind of becoming so chronic and intense. But I think it's scary for people because for a long time they've been in the dark about their bodies. And when you have pain with sex, a lot of women report feeling very broken, like something's wrong with them, like it's their fault. And I'm like, if you injured your hamstring, would you be like, "My body's broken?" You'd be like, "No, you injured your hamstring," right? And that's
Right.
the same thing with your pelvic floor muscles. Like, you have
Yep.
a tight, overactive pelvic floor. We just need to kind of release it and reduce the tension and then get you back to where you need to be.
This is why pelvic floor PTs are amazing. Explain to people what scar release is, because I think that's not something that the medical community really knows. We kinda think it's a little woo-woo. You're like,
Yeah.
we don't like anything we can't see on CAT scan,
Yeah.
right? So, it's like, you release scar and we're like, "What's a scar release?" But
Yeah.
it
And
really
so
helps a lot of people, especially, like, post-surgery.
yes, I'm glad to hear you say that. And so, when scar tissue is formed, it doesn't have the same elasticity and movement that pre surgical or pre scar tissue does. So it tends to have this feeling of being really stuck. And when that tissue gets stuck, it doesn't soften, it doesn't elongate, and you can often feel like something's like ripping or tearing. And then when that happens, all the surrounding muscles and tissues and fascia just get really restricted. It's like these cobwebs that get like really tight. And so I always think of it like peeling layers of an onion. Like you almost want to work outside the scar. Like if it's a C-section scar, you work around the scar and then you start working directly on the scar. And that working on it means like doing deep massage to the area, cupping, dry needling, kind of moving all the tissues and fibers around to help them kind of reorient. It's much more effective if you do it within the first year after a scar is forming, because that's really when all that collagen is laying down and you have the opportunity to remodel. After that, it can totally be redone, but it's more challenging. I can't promise you that it's going to 100% be effective and we're going to get rid of your C-section shelf or totally release your perineal scar tissue. But I think it's absolutely worth working on because it can help soften that tissue, promote blood flow, and release some of the muscle tension and restriction around it. And it's quite simple and it's free and it's
And you can
effective.
learn to do it yourself.
You can do it yourself and you can
Yeah.
have a partner do it on you. And so, again, I think what's really empowering in working with patients in pelvic floor therapy is giving them the tools to help themselves because so often we're like, you feel lost. Like, what do I do? I can't do anything. And when you give someone like, oh, this is what you can do, it's like, "Oh, this is great. Like, I have a way that I can work on my body and feel like I'm making progress."
I love that. Stress incontinence, leaking with cough, sneeze, laugh, trampoline, running.
Yeah. This is your bread and butter.
I know, it's my bread and butter. It's everywhere, and I think so many people are like, "It's not bad enough to need surgery, but, like,
Yeah.
I'm a little self-conscious and I can't go on a run, but, like, but otherwise I'm not wearing a pad, I can do my job without leaking," right? It's kind of this, like, it happens, but it's not bad enough, but, like, what would you tell those women? What should they do?
No amount of stress incontinence or any incontinence is normal. No amount of leakage is normal. As you age, when you have decreased estrogen levels, and estrogen is responsible for the production of collagen, which also helps support your pelvic floor tissues. You have less estrogen, you have less collagen, you have less muscle tone. Your pelvic floor is going to get weaker with time. So, although at maybe 35, it happens with a full bladder and a cough or a sneeze, as you get older, as you have more kids, as you start aging, like this is only going to get worse. And this is why I think it's 50% of women over the age of 65 leak urine. It's like this is half of the population. And it's one of the number one reasons for admission to a nursing home later in life. And you know this, like women are getting urinary tract infections. And we don't think about kind of the long game when we don't address something now. And so what I tell somebody is like, if you address this now, you're going to benefit your body in the long run. Like these little drips of urine that are happening are like a yellow flag waving. And like you have an opportunity to address it and kind of get ahead of it so that you don't end up in diapers down the line, because that is where the majority of women end up because we haven't managed these issues sooner. And so I think a lot of it is saying, hey, like, I love laughing about a little leak, but I also want you to know, like, totally go get help for that. Right. Like, you deserve that. Like, I play tennis and I started playing 2 years ago. Like, at the age of 40, I was like, I need to pick up a new sport. And about a year ago, I was on the tennis court and I made like a quick movement and I felt myself leak. And I have no pelvic floor problems. And I was like, holy shit, I think I just peed my pants. I was like, I'm the vagina whisperer. I can't pee my pants.
My brand, my
Right? I was
brand.
like, this is bad for my brand. And of course, I have on like hot pink leggings, where I'm like, can everybody see it? Like, what do I do? I mean, I was so nervous and uncomfortable, and it consumed my brain space for the entire rest of the match. I lost the match, which was a bummer, but I was like, oh, this is what it's like. When you leak, like, your brain is consumed with that symptom, that feeling, that concern, and you can't focus on anything else. And when you don't realize the amount of brain space and energy it's taking up in your life to have to manage these things. And so I think, and then I was like, you have to practice what you preach, Sarah. You need to do your exercises. You got to use your topical estrogen. Like, you got to do all this stuff that you should be doing. You just kind of rested on your laurels. So again, I think we need to pay attention when those things start happening. We get to them right away. And I also tell women, like, it's never too late. If you've leaked for 5 years, 10 years, 20 years, 30 years, like, you can benefit from working on your muscles, working on your tissues, starting your topical estrogen, whatever the case may be. Like, it's never too late. You're building muscle in your body just like you would anywhere else. And I think it's important for you to know that, like, you can see improvements.
I love that. So of the mild, if I would, what I just described being like mild stress incontinence, what would you say the average success rate is?
From physical therapy?
Yeah, like, I get they if you're over 40, think about vaginal estrogen as well, absolutely helps the collagen. But if you're like, "Hey, 50% are gonna get better, 80% are gonna get better," like, what is the success rate that you would tell people? And I know it's generalization, but, like,
Yeah.
give us some hope. Is it gonna
My
work?
I would say my guesstimate, just based off of my own clinical practice, is 75 to 80%.
That's good.
It's really good.
That's really
But
good.
I will say this, you have to keep up with it.
Yes,
This is
yes,
the
you do.
tricky part, is that
Well,
people are like,
it's like
once
any muscle.
it's like any
You
muscle.
like, I have a beautiful bicep. Can I just, like, rock this bicep forever now? No,
I know.
unfortunately. Yeah.
I'm gonna tell you, after being on book tour and not working out for a month, I'm like, nope, bicep is gone. It's gone. I gotta start over now?
Right, I know,
But it's you have to maintain it. But I think if you are a regular exerciser, these are exercises that you build into your day-to-day workouts. Like, you don't have to have a whole Kegel routine. Like, you do this contraction with lifting weights, with bar, with Pilates, with CrossFit, with, stair stepping. Like, there's a way for you to build it into your day so it doesn't feel like so overwhelming. And especially now with, I think, so many amazing medical providers encouraging strength training for perimenopause and menopause, like, you have to include the pelvic floor as part of that, because if someone's leaking, they're not gonna work out. They're not
yep,
gonna lift
that's
weight.
right.
Like, we don't know what's going on behind the scenes, and not addressing that piece, I think, it's a missing piece that I see in a lot of the education, because you have to be building up your pelvic floor strength just like you do everywhere else in your body. And more women leak urine than have osteoporosis, high blood pressure, and diabetes. And yet they're
Preach.
they're less likely to get help for these issues. So you have to train your pelvic floor.
I see that a lot with people who are like, "Your bones need you to jump, jump every day, jump." And it's like, you realize about 50% of us can't jump.
I know, and you and I know that because we see the people who can't jump, and I'm like, okay, well, you gotta recognize that this is why they're not jumping, like, or they
Yeah,
shouldn't jump because now they're leaking, and we need to train their pelvic floor to help them jump. So,
yeah.
yes, it's the pieces
Well,
of the
yeah.
puzzle.
Let's end on that question. So some people are like, "Hey, I just did more CrossFit and more jump rope, and then my leaking stopped." But I wonder, like, are you hurting it if you're leaking and doing activities? Like, how do you? Am I making sense?
Yep, you are.
Okay,
So, I got you. So,
thank
if
you.
you are experiencing symptoms during an activity, whether it's pain, leakage, pressure, heaviness, that's a sign your pelvic floor is telling you, like, you have pushed me past the threshold of what I can handle. So if you can do double unders and jump rope and do 20 of them, but when you get to 25, you're like, I'm leaking now. I'm like, your pelvic floor muscles are fatigued and you need to stop, or you need to modify and do a single jump rope, or whatever the case may be. So I tell people, like, if you're leaking, scale back, build up your pelvic floor strength, and then you can start increasing intensity or pace or weightlifting. The other thing I'm a huge fan of is internal supports like a pessary, or I'm a huge fan of them because it gives your
Uresta is
yeah,
specifically do you like that?
I
I'm
like
calling out
Uresta.
that brand because I just don't know any other brands.
The other one I like a lot is called Revive, and it looks like a little silicone, like pessary. It's over the counter. There's some other ones that I know that some that are kind of in the work that some companies are researching, but an internal support just like gives you that support that your pelvic floor muscles aren't giving you. So if you like, I want to jump rope, then I'm like, put in. You can even use a tampon. I'm like, put in a tampon, and do your workout so that your bladder and your tissues are supported, and then you keep working on your pelvic floor, but like don't do something that's going to cause leakage. If you can run with a tampon in and not leak, then I'm like, go run, like go for it.
But
But
so
if
many
you're
women
leaking,
are running marathons in diapers. I'm
yeah.
not being funny. Like, they're legitimately running it with lots of urine. Would you advise them to be like, "Honey, back off a little bit, get some help?" Or are you like, "Hey, that's
Yeah, I'd
fine
say
because you
let's
can."
try a pessary. Let's train your pelvic floor. Runners are hard to stop from running. So I
True.
think we have to work with them. And I'm just like, hey, listen, if you're going to do this, then like, you got to know this is what could happen. But like, let's find a middle ground. Like, I'm not so black or white, like you have to stop. But I'm like, what can we do to help you improve your symptoms and help keep you active and run? So there's always a conversation in there that needs to be had. And again, trying something like a pessary or internal support. But I have patients who go get surgery, young moms, and they're want to run and they're not, their pelvic floor, their exercises just aren't enough for everybody. I mean, they're just
Yep,
not.
that's right.
And so I'm like, let's do therapy, go get surgery. We're going to do therapy after. And like, that's going to give you the best outcomes.
Yeah. Some people need surgery. They
100%.
can the descent of all the tissues after vaginal birth, et cetera, collagen loss, and that's why it's there. But to me, like, the optimistic thing is how successful physical therapy can be.
Yeah. And I think I love working with other practitioners. So I think it can be incredibly helpful and it's not that overwhelming. And I think as people read the book, they're like, oh, this isn't rocket science. I'm like, it's not. Like, I'm not like, this is, earth
You
shattering
need to buy an
discoveries.
inversion table.
I know. I'm like, just don't push when you pee and like manage your constipation, like just some easy stuff.
I love that. Well, thank you so much for joining us. Tell everybody where they can find you.
So I'm on Instagram as the Vagina Whisperer and TikTok as the Vag Whisperer because TikTok doesn't like the word vagina.
It's amazing Instagram does.
Again, I think I've just had an account for long enough that I got grandfathered in, so I feel lucky for that.
Nice.
But then I do have a whole kind of online workout program at thevaginawhisperer.com, and then my new book, Floored, is out, and you can find it at any place that you love to buy books.
It might be a great book for, like, pregnancy baby
It's a
showers.
It is. I just went to a book signing last night and she's like, I'm buying this for my friend who's having a C-section next week. I was like, it's the perfect
It's the
book
perfect book for that.
because it's a great time to kind of start learning out about your bodies, that pregnancy kind of postpartum period. So absolutely.
Awesome. Thanks so much for joining us today.
Thanks for having me.